I'm Rachel. I'm going to be your nurse today. How are you today?
Good, how are you?
I'm good. And can you tell me your name?
Kenzie.
Okay. How old are you, Kenzie?
15.
Okay. So because of this video is being performed, do you give consent to use this video?
Yes.
Okay. Alright, so today we're going to be assessing your head and your face and your neck. We're also going to be assessing your skin. Alright?
Okay.
Okay, so first I want to get your temperature. So I'm going to put this underneath your arm. I just want you to place that there and just leave it there until it beeps. Looks like you're breathing 14 times a minute. I'm going to get your blood pressure. You can just lift your arm here. Is that okay? Yes. Okay. Okay, your blood pressure is 104 over 62. Did this go off yet?
No, thanks.
Okay. Okay. 97.7. Alright, Kenzie, can you tell me in the past little bit, about 6 months or so, have you been diagnosed with any skin diseases or conditions that
No.
you're aware of? Okay. Does your family have any skin issues?
My mom has psoriasis.
Okay. What about any other family members that you're aware
No.
of? Okay. What about any drug allergies? Do you have drug allergies? Any allergies to plants or pets?
No.
Okay. Are you on any medications?
No.
Prescriptions or over the counter? You don't take a multivitamin or?
I do take vitamins.
Okay. Okay, perfect. Alright, so any skin changes that you have been aware of? Any color changes? Any blueness or temperature changes that you've been noticing? No. Okay, what about any rashes? Any skin rashes? Any itchiness over your skin?
No.
What about any moles? Do you have any moles or birthmarks?
No.
Alright. Any excessive dryness anywhere?
No.
Okay. Let's see. Have you noticed any bruising anywhere?
I just got a bruise the other day when I was playing in the yard.
Okay, that's typical. But anything like do you notice that you bruise really easy?
No.
Just touching your skin and you bruise? Okay. Any tearing of your skin?
No.
Okay. All right. So what about any hair loss? Have you noticed any hair loss? Any
No.
dryness, balding of your skin? Any itchiness in your hair? Okay. What about any, let's see, nail changes? Have you noticed that you break your nails easy, or do they just crack or anything like that?
No.
Do you bite your nails?
No.
Perfect. That's great. Do you wear artificial nails?
No.
Okay. All right. So, do you have any recent acne that you've been noticing?
Yes.
Where would you describe that acne?
Just on my face.
Okay. Has it been pretty severe?
Not really.
Okay. How do you treat that?
With facial cleanser.
Okay. What type of facial cleanser?
Arbonne.
Okay. Great. What about any over-the-counter or any prescription medications that you take to treat that?
No.
Okay, so the Arbonne is working. That's good. Okay. All right. What about any headaches? Have you been experiencing any headaches in the past?
Yes.
How often do those occur?
About twice a month.
Twice a month. Okay. Do you relate those to anything that you're going through?
Back pain.
Back pain? Okay. So does this occur pretty much the same time each month?
About twice a month.
Twice a
Just
month?
randomly.
Just randomly. Okay. Where's the location of your headache?
Everywhere.
Everywhere, so it's not localized in, like, behind your eyes or a band around your head. Do you notice
It's kind of a band.
a band around your head? Okay. What about any what about any vision changes? Have you noticed any vision changes? Do you find that they go away whenever you sleep?
Yes.
When you go to sleep, okay. What do you take any medications that
Just
help?
Advil.
Advil, and it seems to go away with the Advil?
Yes.
Okay, great. What about any head injuries? Have you ever had any concussions or traumatic brain injuries?
No.
Okay. What about any neck issues? Do you find any pain in your neck? Any difficulty swallowing?
No.
Any lumps or swelling in your neck?
No.
Okay. All right. And then, okay. Any questions for me so far?
No.
Okay. So I'm just going to go wash my hands and then we'll get started, okay? Alright, so I'm going to just assess your skin first. Okay, so I'm just going to look over your skin, make sure that there's not any moles or any color changes, color pigmentation. Your skin looks very even. The skin tone looks even all throughout. Let me see your arms here. You turn over here. Okay. Alright, your hands are pink. An even skin tone. Perfect. Okay. You do have some freckles, but they do not look irregular or have any type of elevation to them. Okay. And let me check your feet. Okay. They are warm. Okay. And they look normal. Okay. Other foot here. Okay, yep, they're bilaterally pink. They look, skin tone looks normal. Okay, let me check the temperature. So you're nice and warm. You're dry. Your skin is dry. Check your feet. Okay, your feet are a little cold. Have you noticed that they've been cold recently?
Sometimes.
Okay, but not extremely cold? Okay. That's typical for your hands and feet to be a little cold, but not ice cold, okay? Alright, so I'm just going to check the texture of your skin. It's nice and smooth. Both sides are nice and smooth. I don't feel any roughness or dryness, which would indicate any hyperthyroidism or hypothyroidism. You're not swelling anywhere. Your hands are nice and even. So I'm going to check for, let's see, and your thickness of your skin. You're not thin. I don't see any type of skin tears, or the integrity looks pretty normal. You do have a bruise right here, but I believe that's what you were stating, that you and your brother were playing, correct?
Yes.
Okay. Alright, so I don't see anything I find that is abnormal with your skin. So I'm going to just check your scalp, okay? So I'm going to check to make sure that there's not any lesions on it. Okay. Not finding any. I don't feel any type of lesions. I'm not seeing anything that appears abnormal to me. your hair. I'm sorry. Apologize about the stethoscope. Okay, your hair is very shiny, which looks very healthy. There's not any dry spots. Looks like you do have some color dye, but I don't see any type of grayish hair that would concern me for any type of thyroid issues. You do have, so your hair looks fine. You've got normal distribution of hair all throughout your arms and your legs. I don't see any abnormal spots of hair. So then I'm just going to go over your nails. Let me look at your nails here. So I'm looking for clubbing, but your curvature is normal. It looks about 160 degrees. There's not any type of grooves or pits that would indicate any type of vitamin or nutrient deficiency. Alright, so now let me just check your head, okay? So, let me look at your nails too. So the cap refill, they're very pink, and underneath the nail it looks pink and good. The cap refill is normal, it's less than 2 seconds. So your circulation is fine. I'm going to check your scalp here. I'm going to just make sure that you've got symmetric formation and no deformities. I'm not feeling any abnormalities. Your skull feels normal, feels equally on both sides. Okay. Alright, so let's see. Let me just make sure, let's check at the base as well to make sure you don't have any lice or any appearance of lice, which I do not see any. And you said you haven't been itching at your scalp or anything?
No.
Okay. Any tenderness at your head while I'm pressing on your head?
No.
Okay. Alright, why don't you pull your hair up for me? Alright, so now I'm just going to check your temporal mandibular joint. So can you just turn your head this way? I want you to open your mouth. Okay. And close it. Open again. Okay, close it. So do feel some popping right there. Okay. Do you have any pain with that at all?
No.
Okay. Alright, so, and then I'm going to check for some symmetry with your face. Your eyebrows look very symmetrical. Your nose and your nasolabial folds look normal. The sides of your mouth are very symmetric. Can you smile for me? Very good. Okay, I don't see any asymmetrical there. Okay, so now I'm just going to check, I'm going to check the range of motion of your neck. So right now your stability of your head is fine. Your head is stable. It's erect and straight. Do you have any neck pain? No? Okay, so can you just take your head and put your chin to your neck, to your chest? Okay, any pain there?
No.
Okay, and bring it back up. Okay, and can you go to your right and your left? Very slow. That's fine. Okay, and then take your other ear down. Okay, now turn. Let's see. Do that again. I'm just gonna make sure I don't see any lymph nodes that are popping out at me or any salivary glands that are swollen. Okay, can you turn your head to the side? Very good. I don't see any swelling. Okay, that way. Perfect. All right. And extend your head backwards for me. Okay, just do it very straight. Okay. Trachea is midline. I don't see any signs of your thyroid. Okay. Alright, so now I'm just going to palpate your lymph nodes, okay? And just let me know if you have any pain with them. Not feeling any swelling. Just going to feel underneath here. Okay. Okay. I'm going to check your trachea here to make sure that there's no deviation, which would indicate that you would have some respiratory issues. You'd be having difficulty breathing. And there's not any deviation there. Trachea is midline. Alright, I'm going to take this light, I'm going to shine it where it will give a shadow of your thyroid so I can see if there's any abnormality with that. Okay, I'm going to get you to take a swig of water. Okay, swallow. Okay, so whenever you swallow, I do see your tissue come up, but it does not look like there's any enlargement or any nodes on there. So do it again. Okay, very good. So now I'm going to come around you, and I'm also going to feel around your thyroid, okay? So I want you, I'm just going to feel your trachea. I'm going to slide it over. So I want you to bend forward. So first take a sip of water, and don't swallow yet. And then I want you to bend your head forward slightly and then to the right. Okay? Okay, and then now swallow. Okay, and do it again. Okay, good. I don't feel any abnormalities. Okay, Kinsey, do you have any questions for me?
No.
Well, I greatly appreciate your cooperation, and I'm so thankful that you do not have any changes in your skin or your head, your neck, and your face, all right?
Okay.
Thank you.
Thanks.